In our last session, we learned about the various settings where the nurse can work in Germany. Today, we will describe about the nature of work in those various settings, in particular, know more about the acute care and the long-term care, and then you can tell us if it is similar to the Indian setting. Chronic diseases are also treated as a part of acute care. Long-term care is used if one is unable to cope with their everyday life on their own due to their advanced age, illness or disability. Acute care only takes care of patients if, for a comparatively less or shorter time. The law stipulates that a short-term care lasts up to 8 weeks, 56 days per year. Long-term care, on the other hand, is designed to take care for a much longer period of time, minimum 6 months or more. Acute care aims to completely eliminate illness or injury, or in case of chronic illnesses, at least significantly reduce the symptoms. Long-term care, on the other hand, aims to achieve the greatest possible independence and a decisive degree of self-determination of the persons in need of care. Each facility, either acute care or long-term care, has developed its own structure, procedures and routines to ensure that the best possible care for their specific conditions, diverse regional differences and the state-specific regulations is taken care of. Now I have to interrupt your flow of thoughts a bit. Not much. To tell you, if you haven't subscribed to our channel, you're missing something. Bridge now specializes in recruitment, integration and retention. We post content about nursing in Germany, living in Germany and the Indo-German culture. And if you are a nurse watching this and know someone who is and are interested in opportunities in Germany, get in touch with us. It is possible to identify overlapping structures that often differ from the daily nursing routine from India. For example, we may have an auxiliary nursing midwife, A&M, who is responsible for providing basic healthcare services. A person who has completed their GNM, his or her GNM, would be a staff nurse or a ward in charge. Or a community health officer would be someone who has completed his or her bachelor's in nursing. In Germany, however, as a rule, each nurse takes care of the same tasks. There is no division of functional tasks. Each nurse has the same responsibility of care. A senior nurse or a ward manager would differ in terms of maybe their roles they play. Example, a ward manager would have the coordinating task in addition to the person who he or she is responsible to take care of. Let us know in the comments section if the difference of settings based on acute care or long-term care is similar or different than in India. So, what is the nature of work as a nurse in Germany? The daily nursing routine differs primarily between specialist areas, the facilities and the working environment. In hospitals, everyday nursing is geared towards acute care of illnesses, ailments or injuries of people of all ages. Nurses work in direct patient care on the wards or in functional areas, such as operation theatre and emergency room. To treat the patients, the nurses work daily with doctors and sometimes also with other health professionals. In contrast, the inpatient long-term care provides care for people who are no longer able to manage their everyday life on their own. This concerns people with long-term physical or cognitive impairments, such as people with dementia-related diseases or multimorbidity. Everyday care is geared towards maintaining and supporting independent living of those people. The people to be cared for are also referred to as residents, as they live in those facilities for a longer period of time. And therefore, your cooperation as a nurse on a day-to-day basis is not with doctors or operating staff, but you may interact with the healthcare professionals like physiotherapists or any other outpatient general practitioner. These institutions usually do not employ their own doctors or as residents go to the hospitals, and it is called as outpatient care. In both professional fields, care is supported by nursing assistants, nurses, the vocational students, and also in many cases volunteers. Unlike in India, where relatives or a companion is present with the person almost round the clock, In Germany, support from the relatives is less prominent. They usually only make regular visits to these facilities and occasionally take care of nursing activities during their stay. Now you may be having this question: if there is no distinction in activities and irrespective of the designation, a nurse takes care of all the responsibilities of care, what exactly is the education system in Germany like? Then stay tuned for our next topic and do subscribe and share it forward.